how can we start to improve these sorts of statistics? And who needs to come to the table for this sort of multi-effort for it to actually change, see that change down the line?
So a lot of our mantra is to turn these measurements into actions. So we always remind, both the public and our physicians that before you can make a change, you have to know there's a problem. And so much of our data first begins to show a disparity. Then we try to delve into, well, what is driving that disparity and how can we correct it? So some of the things are educational campaigns. Obviously, we need to really get the word out still, particularly in underserved populations, about calling 911 and getting urgent attention for stroke. So continue to emphasize that, and education even in schools and in underserved populations. That's a big one. High blood pressure. High blood pressure is considered the silent killer, and many people don't know their blood pressure is elevated. So getting more access to individuals to have their blood pressure checked, and then being able to know their numbers and get on the right medications. A lot of what the American Heart Association focuses on is understanding about lifestyle modification. And we focus on weight reduction, physical activity, not smoking, diet, all of that to help reduce the risk of stroke. So those kind of campaigns. The other thing that we've worked on in the Florida Stroke Registry is to educate our systems and learn from each other. Some people can give TPA and endovascular therapy very rapidly, and they have all systems set up to do that. So in the early phases of our Florida Stroke Registry, we created these modules where we instructed people about giving TPA in the CT scanner, having the TPA ready to go, calling when the EMS person gets there, having the EMS person call the emergency room personnel to let them know a stroke is coming, to get ready, move the scanner, all these things to try to reduce delays in care. And there are many different publications that are out there and best practices to reduce care delays. So we tried to make sure we educated all of our Florida stroke hospitals in these delays. Working with EMS, there have been transport policies that have been established. EMS has a big program now that they're trying to get dispatchers to be better trained in recognizing stroke, with certain symptoms over the phone so that they can dispatch appropriately people to the individual home and get them quickly to a acute stroke hospital. So a lot of it is educational awareness, giving people the right tools to more rapidly recognize and treat acute stroke. Big area of focus for us right now, as I mentioned, is transitions of care, because people come into the hospital, they're getting all this great acute care. We're worried that when they leave the hospital, there is a gap in care. They go back to the community. Is everything communicated? Do they remain taking their medicines? Is their blood pressure well controlled? Do they take their antiplatelets or anticoagulants as needed? And there's this concern that there's not a good transition of care, and therefore there'll be a higher risk of recurrent stroke or possibly a readmission for a complication from stroke. So we're beginning to focus a lot more on models and systems and interventions to improve the transition of care.